Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Women. Now coming into the causes and risk factors. If you're someone who is experiencing pain during the periods and you're watching this video, remember that we are discussing causes and risk factors. If you're coming under any of these causes or risk factors, do take a doctor consultation as soon as possible. The first one we are discussing is the primary dysmenorrhea. So, in primary dysmenorrhea, usually it is because of a certain prostaglandin mechanism and the uterine contraction. Remember, I told you that in the structure and function, the endometrial thickness will be there so that they want to carry the baby. The uterus wants to carry the baby. When there is no baby, the endometrial thickness should be shut down. And how is it shut down? It is pushed down through the uterine contractions. Okay, so by this uterine contraction, by the release of prostaglandin, and sometimes you do not even know why it is happening without any pathological cause. So that comes under primary dysmenorrhea. Okay, these are the causes, that is increased prostaglandin mechanism. Prostaglandins are present in every female, but there is increase in the females who are experiencing dysmenorrhea or painful menstruation. So increase in prostaglandins and severe uterine contractions can cause dysmenorrhea. That is primary dysmenorrhea, which is absolutely fine, nothing much to worry about it. Next, coming into the secondary dysmenorrhea part, why does it occur is that any problem like endometriosis. What is endometriosis? The endometrial layer which should be present inside of the uterus, if it is displaced anywhere, it can be displaced throughout the body, or if it is going inside the uterus, if it is going through the rectum, if it is going to urinary bladder, anywhere, if it is being deposited anywhere, that is called as endometriosis, which can be very, very painful. If you want to know more about endometriosis, you can check out our videos. We have already discussed about it. And then even uterine fibroids, that is a tumor-like growth in the uterus. This can also cause secondary dysmenorrhea. Adenomyosis, if the endometrial tissue is going deep into the uterine wall or the muscle of the uterus, that is also very painful. It is called as adenomyosis. And next, PID, which is pelvic inflammatory disease, can also cause secondary dysmenorrhea. And then other conditions, it can be any other female conditions like PCOD, can also, or ovarian cyst, chocolate cyst, all of these can also cause severe pain or secondary dysmenorrhea. So these are the causes and risk factors. If you're someone who is experiencing pain during every menstruation and you want to decrease it, that is primary dysmenorrhea. And if you're someone who is experiencing pain along with other abnormalities in your flow, that is secondary dysmenorrhea, and you would like to get in contact with us, we have two kinds of consultation options. One is the online consultation, the second one is the offline consultation. If you're someone who is staying nearby the nearest branch of Fidicus, you can come and contact us in person. If you're someone who is staying far away from us, you can contact us online. We have two options, that is audio consultation as well as video consultation. After the audio and video consultation, if we think you are suffering from secondary dysmenorrhea, we will ask you for investigations, or if you have already done investigations, you can send it to us. And after the doctor consultation and after the whole process is done, your medicines will be delivered to your doorstep. That is home delivery option is available, where if you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. And if you're staying anywhere else, it can take 4 to 8 business days for our medicine to reach your doorstep. If you want to consult us, you can call us on this number. You can WhatsApp us, you can message us, or you can call us. If you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. So if you're someone who is experiencing painful menstruation and you do not know what kind of painful menstruation it is, that is primary or secondary, or if you're someone who is experiencing pain in every menstruation and you would like to get rid of the pain to have a better work-life balance, or if you're someone who is experiencing pain along with the abnormalities, that is female reproductive problems, you can contact us. And also, why should you choose Fidicus Homeopathy? Because Fidicus Homeopathy stands for highest chance of health. Here we have 3 principles. One is the highest success rate. See, we are already experiencing a rush of patients who are approaching us for different female reproductive problems, and the success rate is really high. It is good. And also, there is transparency in treatment. That is, that there is no gray area between the patient and the doctor. Any sort of prognosis that you should be knowing, we will be letting you know. And also the personal care here at Fidicus. If you have any sort of myths, or if you have any sort of queries regarding your own problem, we will be educating you. And not only that, we will educate you in all aspects of your problem. So if you want to choose cure, if you want to choose a better life, choose Fidicus Homeopathy. Thank you.